We've been talking about depression, and we initially talked about some strategies from a self-help perspective, things that you can do to manage depression during this pandemic at home. We then want to talk about when we recognize that the depression may be becoming overwhelming. Things, for example, that make us feel as though our lives are crippled and paralyzed, that we're unable to engage in activities of daily living, that we're even unable to make decisions that normally we could make. When we're feeling as though we're unable to engage in life overall, then it may be time to experience and to explore possibilities of professional assistance and help. The first part of that would be assessment. So in this day and age of the pandemic, that very well may be telehealth, reaching out via computer or phone call to talk with someone who can assess where you're currently at, to evaluate your symptoms and to make an assessment of your level of depression. From there, taking a look at what kinds of things may be important to assist you in managing that depression effectively. Individual psychotherapy, again, in this age of the pandemic and the ways in which we're being restricted and moving around in our communities, that would include telehealth assessment and evaluation, telehealth and an ongoing insight-oriented psychotherapy to explore your feelings, to explore the ways in which the pandemic are impacting you in a negative way, and explore the depression as it may be, again, bringing you feelings of paralysis, that you can't make decisions in your own life, that you're not living your life any longer. Medication may be an important part of that. There are changes that take place in the brain and our neurotransmitters that may impact the level of depression and in fact may be the source of depression. And so there are medications that are very effective that can be utilized in order to increase and elevate mood, in order to help you engage in the thought processes and the strategies that will allow you to cope more effectively with depression. So it's important to remember that there is help available and that help may come in a variety of ways, things that you're doing at home in the way of self-care and things that we may be able to provide to you in the form of professional assistance. I'm Dr. Phil Toll, and remember, together we'll get through this.